Welcome to our workshop. My name's Jill Parker. I'm from Voluntary Organisations Disability Group, which is it's an umbrella body which lots of not-for-profit providers belong to, and they work collectively on matters that are of kind of mutual concern. The Voluntary Organisations Disability Group has been working with NHS England on the STOMP initiative, which Carl described to you previously. So I'm just going to ask Carl to introduce himself again, and then I will introduce you to STOMP.
Thank you, Jill. I think everybody knows me now. I'm Carl Shaw, Learning Disability Advisor for NHS England. The way I've been working with Jill is because we're 1 year on into the STOMP work, and originally last year we were looking at professional bodies, so health, so like Royal College of GPs, Royal College of Psychiatrists. But in the second year we've put, well actually there needs to be a focus on social care providers, making that gap. So Jill's very kindly helped us to spread the message of STOMP and talk to social care providers or people in the community. Thanks, Jill.
Thank you. Okay, so I'm going to start by just running through our presentation. If people have got any comments or questions as we go, I'm quite happy to take interruptions. So just wave your hands and I'll come over to you with the mic. I'm hoping that we'll be able to manage the time sufficiently well that there'll be some time for discussion on tables as well. So I'm going to crack on. So we're going to start with Simon's story. So Simon is a real person. He doesn't look like a real person there, but believe me, he is. He lives in Yorkshire and he's supported by Lifeways, which is a learning disability care provider. So when Simon went to Lifeways, he was on multiple daily doses of antipsychotic medication, both regular and as required medication, and he was being given 52 separate doses a month for behaviour, in inverted commas. And with support from his new care provider, over a 9-month period, all his antipsychotic medicines have been stopped. And Simon is living a good life, and he was able to reduce and then stop his antipsychotic medication through a positive behaviour support programme, like the one that was described to us earlier, by having a lot more meaningful activity in his life, especially when he was at home, so that he didn't have periods when he was getting bored. There was communication training for the staff so that everybody was communicating with Simon in the same way, and also the daily use of what's called functional assessment, which is about looking with Simon at his behaviours and what purpose those behaviours are serving for him, and helping him think about other ways in which his needs can be met. So Carl presented this slide to you before, but I've put it in this pack as well, because I just think it's really, really important to just think about the numbers of people that are affected by over-medication. So this piece of work was done at the beginning of the STOMP project, and it will be done again towards the end to evaluate the impact of the work that we're doing. But first time around, Public Health England estimated that every day between 30 and 35,000 adults with a learning disability are being wrongly prescribed psychotropic medication. So that's medication that alters people's mind or their thinking or their ability to kind of function in the daytime. And unnecessary use of this sort of medication puts people at risk of all sorts of side effects, including weight gain, organ failure, even premature death. So, as Carl said, the STOMP project has been running for some time, and its focus has been primarily in health. And my role has been introduce STOMP to social care providers. So the STOMP Pledge for Social Care was launched last month, and it aims to equip social care providers to take real and measurable steps to stop over-medication. And it's been supported by all these organisations. It's also supported by the Care Quality Commission. So while they don't endorse specific initiatives, what they are doing is they're training all their inspectors in adult social care around STOMP principles. And so when inspectors are going out, to inspect services, it's going to be one of the things that they're going to be looking at about, are people receiving the right medication in the right amount, are people being over-medicated, and if so, what's the service provider doing about it? So there are 8 commitments in the STOMP Pledge for Social Care. And the first one is that we will actively promote alternatives to medication, such as active support, intensive interaction, or positive behaviour support. So that's all the things we've been talking about already today, about how we communicate with people, about how we support people to live a good life of their choosing. The next pledge is that we'll ensure that people we support and their circle of support are involved in decisions about their care, including their medication. So often we hear stories about people are on medication and they don't know why they're on that medication, they don't know how it happened, it's something that happened to them, it wasn't something that they were a part of, and that needs to change. The next pledge is that we'll ensure all staff have an understanding of psychotropic medication, including its main uses and side effects. And what staff really need to know in social care is about the medication of the people that they support, and how to look out for side effects, to kind of understand the reasons that people are on medication, and to help explain that to the person, and to help the person really kind of have a voice when they're going for their meds reviews. The next pledge is that we'll encourage staff to speak up if they have a concern that a person we support may be over-medicated. And that means social care staff need to kind of understand a little bit about, you know, the signs and symptoms of being over-medicated, so that they can speak for people when they need to. The next item in the pledge is that we'll maintain accurate records about the health, well-being and behaviour of the people that we support. And then that we'll support people to have regular reviews of their medication. And a number of providers, when they've kind of started to implement the pledge, that's kind of one of the places where they've started. So if people are with learning disabilities are taking psychotropic medication because of some of the behaviours that they present, then they should have a multidisciplinary review within 3 months of that medication being prescribed, and then every 6 months, or at least every 6 months. And finally, we're asking people across the sector to commit to working with people with learning disability, autism or both, their families and health professionals and commissioners to stop over-medication. And obviously this includes working very closely with prescribers. So we've been talking to providers about the sort of practical steps that they might take. And the sort of things that we've been talking about, you know, we've already been talking about very much today. So it's about developing, person-centred care, having person-centred plans to support people to take part in decisions about their medication, about involving their family members or advocates when that's what the person wants, about working with prescribers, about offering other activities or approaches that support medication reduction programme. So reducing somebody's medication isn't something that can happen in isolation. It needs to be happen in a planned way in which the person is well supported and any risk is managed. And also about ensuring that people get their regular multidisciplinary reviews and health checks. Other things that providers are kind of putting in their STOMP action plans are around staff training, around auditing the use of psychotropic medication, sometimes just like in local services, but often right across quite large organisations. So one of the things that we found when we've been talking to some very large organisations is that they've needed to go and find out the scale of the use of psychotropic medication to manage behaviour across their organisation. And that wasn't information that they had at their fingertips, so they needed to kind of go and do a bit of research first because they needed to then work out what resources they should apply to this. Some organisations are looking at their medication policy, making sure that STOMP principles are embedded in there. I've already talked about considering what resources are needed to make sure that everybody's safe when somebody's going through a medication reduction programme. And also there's some really, really good practice out there, and we're trying to provide a platform in which people can share that learning. So there's also been a STOMP pledge in health. This time last year, the Royal Colleges got together and at kind of the highest level, they agreed that they would work together to support the implementation of STOMP throughout health. So social care has been doing some catching up, but I just put that in because I wanted people who work for social care providers to kind of understand that all the bits of the system are sort of gearing up to kind of working together to support people to make sure they're on the right amount of medication at the right times and what's right for them. But change is hard. So only the other day I was talking to a psychiatrist who says, people come and sit in my surgery with a support worker, and the support worker might spend half an hour explaining how extreme this person's behaviours are, and they want me to fix it with medication. And then we talk to GPs, and GPs say, well, it would be great if this person could reduce their medication, but actually the social care provider doesn't have the behavioural approaches in place that are needed to support that. And then we go and talk to social care providers, and they go, well, we think it would be great if somebody could be on less medication, and we can see that it's not good for them, but this is what the GP or the psychiatrist has been prescribing, so we're just doing what we're told. And so everybody kind of feels quite powerless in this. And of course, that, the person with the learning disability is kind of missing from that slide, and they're kind of sometimes the most, or the least powerful person in this scenario. So I'm going to, before we come to the discussion, has anybody got any comments or questions that they'd like to share with the group? We're getting tired, it's a bit close to lunchtime, isn't it?
Oh,
yeah.
Sure.
So I've had the luxury of being able to see kind of this kind of presentation in other settings, and also see things like Lixit do work around this. But one of the things that I haven't seen, and parents anecdotally have handed over, is the PA personal assistant workforce, and also children and young people that are coming through transition that might be on amphetamines because it works very well for children that end up having had a medication review, and where does STOMP fit in with that kind of group, so personal assistants, families, children in transition?
There's certainly a work stream to look at people that are working in children's services and to spread the word about STOMP there. PAs is kind of much more difficult because they're so isolated, and you know, we're kind of finding as the kind of STOMP snowball kind of goes down the hill that, you know, kind of more and more people are getting involved, and there are more and more groups of people that we understand we need to involve, and PAs is a very good example. The STOMP Pledge for Social Care was launched about 5 weeks ago, and it had kind of quite a lot of coverage through, you know, kind of through all the organisations that have supported it and on Twitter. You know, so some PAs have kind of picked that up and have taken the initiative and, you know, are kind of running with it, but they really are the kind of few and far between and the early adopters. So we know that that's an area of work that we need to look at. We've also got people in advocacy organisations, in day support. There are also training providers, for instance, have started to sign up, but again, they're not an area that we've targeted so far. So yes, there's a lot of work to be done. And you know, we're kind of part way through a project, and I'm just sort of explaining to you where we are really.
So it's a different point.
Yeah.
I just wanted to know, do you get involved in producing easy read information? I'm just touching on what you said about people not understanding the medication that they're taking and why. I know easyhealth.org has some easy read information, but from the last time I looked at it, I personally think it could be improved. There could be other forms of that easy read information. I think it's in black and white, and it covers probably a couple of the medications, but not all of them. So I just wondered if you get involved with doing any of that, or producing.
So between the University of Birmingham website and Easy Health, there is information about 35 psychotropic medications on Easy Read.
Can I add, Jill?
But there is 35.
Yeah.
Can I add, Jill, as well?
Yeah.
Just like to say as well, NHS England are working with a company called Change. I think people will be familiar with the Change Picture Bank. And basically what we've commissioned them to do, what we've paid them to do, is to produce a guide where for people with learning disabilities and autism, what to expect when they go to a GP. That's still being designed. We've got a draft one so far, but that's another thing we want to work with and get on our NHS England website as well.
Also on the NHS England website, there's some easy read information for people with learning disabilities who've heard about STOMP and are worried about the medication they're taking. And you know, it just gives some basic guidance about don't just stop taking your medication, but talk to the people around you that you trust and go and speak to your doctor about it. And finally, I'm developing some guidance for frontline staff about supporting people to go to a GP or a psychiatrist for a medication review. And within that, there will be an easy read form that the worker can go through with the person with a learning disability and help them prepare for the appointment. Michael, you've been waiting for ages to say something.
Well, if there's one area that isn't being targeted right now, it's the people in residential homes, because they're using their own procedures to deal with the problem, and they're not understanding how to follow the STOMP procedures. Is there any way that can challenge those residential homes to follow those rules?
That's a really good question. Thank you, Michael. And that's exactly what we started to do, what we intend to continue to do. So the STOMP Pledge for Social Care was launched just 5 weeks ago. And so far we've got over 90 care providers have signed up that they're going to make some real changes in their organisations. And for each of the care providers that signed up, they're being asked to develop an action plan which I will monitor to make sure that when they sign up, it's not just a tick box exercise, but that it really means something and that they are going to make a difference.
A few years ago I worked with a lady that fell into elderly care as a mistake and was left there for 5 years. She was significantly visually impaired, but they didn't really understand that, and instead they massively over-medicated her with antidepressants and antipsychotic medication. My question really is about, there are a number of people with learning disabilities that do get almost dumped into elderly nursing homes because it's cheaper when they reach that point in their life. What can STOMP offer those people that seem to fall out of the learning disability sector and into elderly care?
I guess that's, we were talking about kind of other kind of areas of, or other groups of professionals that we need to work with going forward, and I guess that's another one. So yes, it's really about making the message as widely known as possible.
Can I add? Yeah. In NHS England, there's 2 groups. I will get to your point. There's the steering group and there's the delivery group. On the delivery group, there's a colleague of mine and Jill's called Dave Branford, and people in the delivery group have different work streams, and one of them is Dave is leading on his leavers and drivers. So that's about connecting with other pieces of work that's going on. So I've not heard of that point before, but I think it's something that does need considering for us to take back, myself and Jill. So thank you.
Could I give you, say, 10 minutes to talk on your tables around these questions? So it's about how can you work proactively with healthcare providers or with other people that in the sector to tackle over-medication. What is it that you need to do from your perspective? And you might be somebody who's got a learning disability, who's taking medication, and so for you it might be about making sure that you get your health checks, or you might be a care provider and you kind of need to kind of take some of this information back to your service. And then the second question is, what else needs to be in place locally and what can you do about this? So can I give you 5 minutes? Okay, everybody. We've got 2 minutes. We've got 2 minutes.
Yeah, basically.
Has anybody got a key point from their conversations that they'd like to share with the wider group?
We might have when Carl says what he wants to say.
I think that's a no. I think you're all really caught up in your conversations, which you're very welcome to continue over lunch, and we'll draw the workshop to a close there. So thank you for your time, for your attention, for